Hello, I'm Dr. Neil Schultz, and welcome to DermTV. Welcome to DermTV Viewer Questions Week for March 2012. Today's episode will feature questions from YouTube viewers. And don't forget, as part of Viewer Question Week, I'll be answering viewer questions over live streaming video at beautyrxlive.com. So if you have a question, tune in this Wednesday at 2 p.m. Eastern Standard Time. So let's get started. Actually, the first one really isn't a question, it's really a comment, but it's a real important one. Unipeach20 said, I've been watching these videos for a while, and it seems like all you talk about is exfoliation and sunscreen. Well, that's not all we talk about, but that's a very, very accurate observation, because so many episodes are about either sunscreen or exfoliation, and there's a very good reason for that. Sun protection is the single most important preventative thing you can do for healthier, more beautiful, and younger looking skin. And exfoliation is the single most important therapeutic treatment you can do for younger, healthier, and better looking skin. So there's a reason that we talk so much about sunscreen or sun protection and exfoliation, because they are so pivotal to having the beautiful skin that you want. Now, of course, in addition, there are specific targeted problems that we discuss, but there is an underlying current of yes, you do need to use sunscreen every day, and exfoliation is so very important for almost everything that we're doing and telling you, whether it's about making your skin look younger for facial rejuvenation, helping prevent and control acne breakouts, or even helping to prevent skin cancers. So please keep watching and keep in mind how important sun protection and exfoliation are. The next question is from Memories 321. Dear Dr. Schultz, after I shower, I apply my nighttime skincare. Do I have to go to sleep right afterwards, or can I wait a few hours? I actually think that's rather cute and very touching, and the reason it's touching is because Memories 321 evidently is hanging on my words and taking what I'm saying so literally, and I just think that's wonderful. I'm happy to tell you, Memories, that no, you don't have to go to bed right after you've put on your skincare that I tell you to put on at bedtime. That's just my way of telling you, put it on at the other end of the day, after the day, when it's nighttime, but of course, whenever it's convenient for you, after you've put on your nighttime skincare products, that's when it's time to go to sleep. Jareen 37 says, Dr. Schultz, I'm 41, have pale skin, which is in pretty good shape, but what frustrates me is the white fuzz I'm growing on my lower cheeks and near my mouth, which in the last 8 months is becoming an issue. Makeup makes this more visible, so I'm having to basically shave that area, which in return gives me little bumps and doesn't feel smooth. My face is sensitive. I'm not sure I want to slap hair-dissolving creams all over my face. Are they safe to apply? Any other recommendations? Jareen, what you're describing is a very common situation in women in their 40s and 50s, and it's this very fine peach fuzz hair, which is called vellus hair. It is not capable of being removed by laser hair removal, which is my favorite way and the most effective way of removing hair permanently. And the reason you can't do it is because the color of the hair is just too light. So you're describing something which actually is very important. When you put your skincare products or makeup on, it actually coats those little white hairs and makes them look more conspicuous, more obvious. It's the same thing that happens, and the same reason that you use mascara. Mascara coating on your lashes makes them look fuller or thicker or wider or more prominent, and the same phenomenon happens with those vellus hairs. And by the way, that's why we exfoliate our skin, to take off the dead cells that stick up and would otherwise be coated by makeup and other skincare products and be made to look more prominent. So your options are, for removing that very fine white vellus hair, your options are shaving, which as you've indicated, actually makes you break out a little bit, and that's not uncommon. Or you can also wax, but you know how I feel about waxing, because when you're pulling those hairs out, it sets you up for some ingrowns. So what we're down to is the depilatory creams that you mentioned. And Depilatory creams, when used as directed, are quite safe, and probably, in terms of aesthetics, femininity, probably are a better solution than shaving. So you really have summed it all up. The reason that it makes it look worse, that your skincare products and makeup make it look worse, is simply because you're coating those hairs. So you do have to remove them. You can't use a laser. And I think that using chemical depilatories to actually dissolve off the hair probably is going to be the best solution for you. Shangri-La 628 asks, "Hi Doc, how can we get rid of dark underarms? A lot of women of color have this issue." By the way, it's not just women of color. Other women, Caucasian women, have this problem also. "A lot of women of color have this issue where the underarm area is a darker shade than the rest of the skin. Thanks so much for your great videos." Shangri-La, thank you for that very nice comment. In women of color, when the underarm area is darker, and this also happens sometimes on the upper inner thighs, it happens as a result of the accumulation of dead cells that have just too much pigment in them. Now, because your skin naturally has more pigment, the extra layers, one on top of another, of cells then carries even more pigment. So this isn't going to come as a surprise to you, but we're back to exfoliation to remove those extra layers of dead cells and bleaching to stop the new cells that are forming from making all that extra pigment, which your darker skin is so capable of making. Because this area is really an area that's not being exposed to the sun, sunscreen is not important here as part of the solution for your problem, but it's going to be regular use of a gentle chemical exfoliant like glycolic. And because these areas are areas of more sensitive skin and an area where the skin actually folds against the skin as your arm comes down and compresses against the side of your body, you need to use a more gentle or a lower strength exfoliant. So I would start with a 5 or an 8% glycolic product. And the bleaches that you use can either be peptide-based, which are the bleaches that I like in preference to hydroquinone, or they can be over-the-counter 2% hydroquinone bleaches. The exfoliant should be used once a day and the bleach twice a day. Give it a month and you'll see really good results. Deej 876, "Hi Dr. Schultz. I was wondering, does heavy makeup cause wrinkles or any other problem for your skin? I wear a lot of makeup to cover freckles, scarring, and redness. I have very pale skin, so these show up quite a bit. Thank you. I love these videos." And thank you. So the question is, will heavy makeup cause wrinkles? No, heavy makeup won't cause wrinkles. What you have to make sure of is that your makeup is appropriate for your oil and water skin type. So if you have oily skin, you need to use a water-based or oil-free or non-comedogenic makeup. And if you have dry skin, then you certainly want to use a neutral makeup. And just make sure that even if you have mature skin, which doesn't have any oil, make sure that the makeup, that the oil and water composition of your makeup is appropriate for your skin type. And don't be afraid of putting on a little extra in areas that require more coverage. But keep in mind that there are certain colors, particularly red colors on your skin, that are very easy to neutralize with a complementary colored makeup that's on the opposite side of the color wheel. So green is opposite to red. If you're trying to cover red spots, use a green tinted foundation and you'll find it's really, really easy to hide those spots without putting your makeup on so very thick. So that's it for today. And don't forget, the subjects from so many DermTV episodes come from your questions, which are great. So please keep sending them in, and I'll keep answering as many of them as I can. Please join me again at dermtv.com. If you have a question, please send it to me by visiting dermtv.com/question. I'm Dr. Neil Schultz, and thank you for watching today.